So I see everybody is already welcoming themselves as they come in. That's fantastic.
Let me do that.
It's amazing to see so many people from so many corners of the world. If anyone needs Spanish interpretation, I think there is a link there in the chat that you can use. So I think we'll go ahead and get started and hope that our other speakers will join us as we go along. My name is Ami Bishop, and I am the Senior Research Advisor for Outright Action International. And we're really thrilled to have you all here for this very timely discussion on the impact of COVID-19 on LGBTIQ communities around the world about 8, 9, 10 months later, depending on where you are. Sadly, we've all been enduring this pandemic for a long time. We'll hoping to reserve some time for questions and answers at the end of the session, maybe 10, 15 minutes or so. But you all should feel free to post questions in the chat as we go along, and I'll do my best. Louisa and I will do our best to track those and get to them at the end. And another note is we are being recorded, but only the panelists and moderators are visible on the screen, so any participant's privacy is protected. So I'm going to briefly introduce you to our panelists. I'm not going to go through their entire biographies. You can read the full biographies on their on the website. But I'm really thrilled to be joined by these two people right now, and hopefully two others soon. So first, let me start with Alverna Innis. From Antigua. Alverna studied gender and development at the University of the West Indies and attained several professional certifications in the field of domestic and family violence, HIV and AIDS, and human trafficking. They served as a court advocate for persons affected by domestic violence for 17 years while at the Directorate of Gender Affairs. Welcome, Alverna. So nice to have you.
Happy to be here.
Next, we have Jennifer Akoba, who's the founder and executive director of One Action Foundation in Nigeria. She's also an entrepreneur. She's a leading advocate for LGBTQ youth rights and uses social media amongst other key project initiatives to create awareness for social issues such as socioeconomic issues, sexual health, mental health, education, and suicide prevention among the LGBTQ plus community within Nigeria. So thank you. I'll briefly just share our the bios of our other two speakers, hoping that they will be able to join us. Letitia Opio is the founder and executive director of Queer Youth Uganda since 2006. She's been working for the LGBTI movement since 2002. Was involved in local, national, and international advocacy, including being involved in campaigns against the anti-homosexuality law in Uganda from 2009 until the law was annulled in 2014. And then finally, I'm hoping that Bhumi Harendran will be able to join. She's a transgender activist in Sri Lanka and is the founder and the executive director of the National Transgender Network in Sri Lanka. She's widely known for her efforts to raise awareness about the transgender community in her country. She's also a talented dancer, performer, and award-winning actress. So we're hoping very much that Bhumi and Letitia will make their way to this session. So again, thank you all so much for being here, panelists and participants. Before I start with questions to our panelists, I'd just like to briefly give the audience some background on Outright's work related to the COVID-19 pandemic. In May 2020, we undertook some rapid research to quickly identify how the emerging pandemic and related containment measures were impacting our communities around the world. We managed to interview about, 59 people from 38 countries over the course of about 2 weeks. And what we found actually stunned us, even knowing that LGBTIQ people typically suffer disproportionately during emergencies, we were somewhat taken aback by how quickly things had become difficult for our communities around the world. Even then, the impacts were profound and were devastating for many. Through that research, we identified 7 key themes regarding how the pandemic was affecting our communities. Just very briefly, these were first, devastation of livelihoods and food insecurity. Next, the next theme that we identified was quite prevalent disruptions in healthcare access and reluctance to seek care. We also heard a lot about elevated risk of family and domestic violence, about increased isolation and the risk of mental health challenges, also increases in societal stigma and discrimination and scapegoating, meaning LGBT communities being blamed for the pandemic in one way or another. Abuse of state power, increases, for example, in repression, exclusion, militarization, criminalization in response to the pandemic, the measures from which were also disproportionately impacting LGBT people. And finally, increasing threats to organizational survival. Really, we heard from many activists around the world saying the pandemic has potentially set their movement back by years for all sorts of reasons, being unable to do their work, unable to access the funding that they need. In response to what we learned through this research, Outright quickly established a COVID-19 emergency fund. And eventually we raised over $1 million, about $1.2 million, and supported in the end, reached more than 50,000 people around the world, funding more than 115 or 20 community-based organizations around the world, and turned out to be the largest effort that we know of that was reaching out to support the LGBT community around the world, communities around the world with support. So our panelists today all represent organizations that received this support. And so I'm going to turn to them now. I'm sure you're eager to hear from them. And I'm going to start with Jennifer, if that's okay.
Yeah.
So Jennifer, in Outright's research report released last spring, as I mentioned, we found that food security, declining mental health, elevated risk in domestic and family violence were among the leading issues facing communities. In your application for emergency support, you highlighted some of these same issues. Can you tell us more about the needs that were facing your community in Nigeria at the time that you sought this support, and what the situation is now?
Okay, thank you, Amy. First of all, I would like to thank Outright for giving me the opportunity to be a speaker in this year's Out Summit. I think I'm really happy with it. And to answer the question which you just asked, I feel that one of the things we need to and try to think about is when there's a pandemic in the country or in the world, for example, it hits everyone across all levels. And this does not exclude those that are marginalized as well. And then when you now look at a country, like my country, Nigeria, unfortunately, LGBTQ plus people are the marginalized individuals. So when this pandemic happened, there was a total lockdown from the government, and having the total lockdown meant shutting down of non-essential services, schools, and other businesses. And the moment this happened, one of the things that we experienced, we had so many people reach out to us, people sending us messages, seeking for help, and most of them were asking for financial aid or just basically asking us for help to improve their lives at that moment. So what we did at that point was obviously we could not anticipate how long the pandemic was going to be for. So what we did at that moment was we were providing the little that we could. But unfortunately, we started getting more inflow of requests like on a day-to-day basis. So we thought about it and decided to conduct a survey. So the survey we conducted was to basically give us an overview of the impact of COVID-19 on LGBT individuals, the living condition in Nigeria. So when we did that, we um, we had about 207 responses, and from the 207 responses, we had about 202 responses that stated that COVID-19 was affecting their day-to-day activities. So if you think about it, from 207, we had 202 people. That's like above 97.6% of people who have stated this. And then aside from them also talking about how it's affecting their daily activities, we also had about 158 people who responded stating that they will, because we asked them the question, so if we were to provide essential services to you for duration of 1 to 3 months, how long do you think that that would be helpful? And we had about 158 people who responded saying that it would be helpful. And those 158 people wanted non-perishable goods. So we put it under the umbrella of non-perishable food, laundry, call cards, and then thank God for with the help of Outright, we were able to provide to 133 LGBT youths across 22 states. So, and the good thing is, this survey has given us the opportunity to get a project called the Rainbow Project, which was an initiative where we started seeking for funds, and we used it as also as a supporting document when we applied for funds as well for the emergency response. But this is just addressing the socio-economic issues. If you then think about what's happening right now, what's how like 8 months from now, what's happening right now in Nigeria, we had, if I go back to that survey, we had about 89.7% of individuals who were within the ages of 18 to 35, and these are youths. These are individuals that are still in school, or they are young entrepreneurs who just maybe started small businesses. So with the hardship happening in the economy, obviously it means that you cut down their finances. For the students, most of them, their support system are their friends who are with them in schools. But now with the pandemic, they were all forced to go back home, and some people live in homophobic families. So you're quarantining with homophobic families. You're quarantining if you're an individual in an intimate partner violent relationship. You're quarantining with those people, and at the end of the day, what happens is that you're left helpless. You're left helpless, no help, and then that starts drifting to your mental health. So one of the things that we found out now is not just affecting your social economic issues, it's not affecting the psychosocial issues as well. So now we're thinking, how do we then go from this? So what?
Jennifer, can you hear us?
Yeah, I can hear you now. I couldn't hear you guys. An echo.
Okay, just repeat the last sentence or so that you said. I think we lost your connection a little bit, but it's back.
Okay. So what I was saying is, aside from us now looking at the socio-economic issues, we are now drifting to the psychosocial issues because people are now reaching out to us. So what we are doing right now in One Action is to try and see areas in which you can help. So we're conducting a survey at the moment to try and have a better understanding as to the mental health of individuals within LGBT individuals within Nigeria. So hopefully, with the result from that survey, we can make clear informed decisions on what to do moving forward in terms of the pandemic as a whole.
So much, and we're going to come back maybe with some follow-up questions from here for the audience, but I think that really gives a very good picture of what the situation was and what you were coping with within your communities. And you know, the issue of just those basic needs, I wanted to point out at the beginning that 57% of the requests from the emergency fund were for food support. So it was a huge, huge issue for so many communities around the world. Alverna, let me turn to you next. You know, I know that many people in the Caribbean and many LGBTIQ people in your region are involved in the tourism and service industries, for example, as well as in informal work. So the lockdowns must have really hit your community hard in Antigua. And I'm just wondering if you can share with us how you determined who was in need and how you mobilized support, and also what the situation is now.
All right,
Over
thank
to
you very much. Okay, thank you very much, Amy. Everybody's hearing me? You can hear me? Thank you very much for having us. And I cannot say on behalf of my organization, thanks enough to Outright for making life easier for persons within the LGBTQ community during, we're going to say, the first phase of the pandemic. We heard of the pandemic. It was Corona first, then it turned into COVID-19 around January thereabout, and our country went into a state of let's say over shopping, and we are a hurricane-prone tourism country, and we are accustomed in terms of like stocking up for hurricane and so on. So hearing what was going on around the world, and using a sixth sense as an organization, we decided, you know what, let us do a survey, just like my colleague Jennifer. We did a survey also to find out who are most vulnerable. We are all vulnerable. But then we decided to look to see who were most vulnerable. We did not only do that for our organization only, we also involved in other organizations and spread it out to the wider community. And what we did, we asked for food, looked at person vulnerable in terms of lack of family and community support. We look for food, we look at health, we look at housing, and we also look at security. And while there were persons in terms of the health needs, we know exactly where we could have referred them to in terms of getting continuous care for health. As it relates to the issue of housing, there were a few persons, and then we decided, you know what, let us as a group go talk to the landlords and buy some time and piggyback on what the government has said. The government had asked persons, landowners or family members, to be very lenient in this time. So we piggyback on that. And we conducted a survey, and it was a little over 100 and something persons. And we identified 50 persons that we consider most vulnerable. And we had no money, or we had little money. So the first time what we did was to put a few things to get out of our pocket. And again, thanks to Outright, we had some extra funds left over from a project. And we decided to go do the first packages, the food packages. Good for us. When we did our assessment, it was not difficult in terms of finding out exactly what were the food consumption for persons, because we know hurricane is the thing, and we prepare for hurricane. So it's a lot of dry food and those sort of things. So it was very, very easy for us. We had applied for support from business places, because the entire country, the entire island, give credit to those persons, to the organizations, business places, and so on. They were very supportive to the government, giving food bags and food baskets and those sort of things. But when we applied, we were told it was too late, and it was not accepted. So we found, with the little money in which we had, and not knowing exactly where to turn to after the money would have been exhausted, we found a little supermarket. Being part of the over shopping and so on, we found a little supermarket, and they were very generous to us. They give us discounts, and they even packed the bags for us at that time when we were afraid how all those boxes and such going to go into your homes, and with COVID, and they say you have to be very careful with boxes and all those sort of things. So they packed the bags and give it to us, and they even give us some extra stuff. So we made that distribution. and it went real well. We worked very close with the police also. We were on a lockdown, and we managed to get our pass from the police, so that we could have gone to all wherever it is that we want to go in terms of meeting our membership and also persons from the community at large. The packages from the first package that we gave out, we realized it cushioned family members and it made life easier for persons who were breadwinners for the families. And with the criteria that we had set, we look at persons who had no other income, no family support, no community support, and we also look at persons who may be in a relationship. Those are some of the things. Some of the criteria in which we set, and they were all told that, listen, in event of us receiving contribution, at that time it was from the business places, those persons who we will consider, let's say, a little better off from where we start from, that's like a continuing assessment. Those persons who will consider a little better off, we're going to take you off and bring on other persons. We had about 100 and something persons, as I said earlier, on the list. It happens that we applied for the grant from Outright, and we were successful, and it made life much easier. It warms the heart when we deliver the first packages from the persons, and they were like, what? And the praises and the persons, persons tell persons, and when persons are saying they walk so many miles just to get the package. When persons heard about the packages and what they got in the package, just basic stuff, right? Our phones just off the hook straight. And it came to an end. And what we did is that during the course of the pandemic, some persons were able to, well, we are still in the stage of the pandemic, some persons were able to return to work, and some persons are still out of job. And what we did for those persons who returned to work, we took them off, our list, and we put the other persons who were still out of jobs in a little better state, and we put them on in terms of receiving the package. So while we cater for 50 persons over 3 months period, that's for the grant in which we received, we were able to distribute 75 packages to persons, and we distribute about 137, 140 packages during that time. Where we are now, we are a tourism country. The airport is open, so persons are coming in. A few persons are back out at work. Persons from those who are vendors and which support the economy, the tourism products, mostly, like they are not employed, because remember, there's no vending now. So what we did, we assist them in terms of like thinking outside of the box, and we found other source of employment for them. You may have a 2 days, you may have a 3 days, you may put them in the little security and those sort of things. Moving forward, we are very optimistic now that the vaccine is out, and our Prime Minister, he pledged the swift procurement of the vaccine. So we are going to be able to get everybody back to work, and persons are going to be able to be gainfully employed. We move off from there. But again, we cannot say thank you enough to Outright for making it possible for us. And until now, persons jokingly would say, when Outright give her the next grant in order to buy stuff for us and so on. Until now, it's like, but they're serious. And one thing that it did also, given the packages, what it did for us, it increased our membership. Everybody want to come and join mesh now. We did not take on everyone, but what we said to them, we can work with you in terms of developing your organization, because our organization is not only about the food packages, it's also about the empowerment of individuals and so on. So that is where we are right now. Persons are still out of employment. We are looking now at the festive season, and an organization who knew about our way in terms of mobilizing, they asked us to mobilize the persons for them who were affected by the recent torrential rain in which we had. So we mobilized the persons for them, and instead of paying, we asked them, listen, they're mobilizing for food and clothing and so on. We said, okay, instead of paying us, okay, give us some of the supplies in which you have, so we can also give to our membership. So that is where we are right now.
Great, thank you so much, Alverna. You know, it is interesting, you being in the Caribbean, that you actually do have perhaps special experience in emergencies, given that you're in the hurricane belt there, and I imagine it's similar in other parts of the world that unfortunately do experience natural, weather events and other kinds of threats like that. But thank you so much. I'm going to turn now to Letitia Opio. Letitia, can you hear me okay? Are you there? I see you. Can you hear us? I think you might. Yes, great. Okay, terrific. So let's see. Yeah, make sure you're unmuted. Unmute this mic. Okay. So I just want to make sure our sound is good. So I'm going to address you in this next question. You chose to support particularly the transgender community in grassroots communities in Uganda to address gaps in healthcare, I think, as well as food and hygiene supplies. And I'm wondering if you can, in particular, describe some of the circumstances of trans people during the early days of the pandemic and how you chose to support them. And as with the others, if you could talk a little bit about what the circumstances are now. So I'll hand it to you there, Letitia.
Yeah. First of all, thank you very much for having me in this particular time in this conversation. And I would like to thank Outright International for giving us this platform at this particular moment to express our sincere thanks to you, like the way Nifa said, and of course, Mimi has also said. Well, first of all, I'm a transgender woman, and I'm a director and a founding member of Queer Youth Uganda, which was founded in 2006. This organization has suffered a lot and worked tirelessly. Queer Youth Uganda operates in 4 regions in the country and is the biggest organization so far we have in Uganda. Basically, when this pandemic came in 2000, this, of course, that was around March, I think around 15th of March is when actually the president of Uganda announced publicly and said there's going to be a lockdown completely. There will be no transport movement completely from one place to the other. And the curfew started from 7 o'clock in the evening to 6 o'clock in the morning. So life became very terrible and difficult. There was no movement at all. People were told to stay in their houses completely and so. But remember, in the movement where I serve in, a number of our members are mostly upcountry. They are not in Kampala. They are not in the big cities. And it involves you traveling for almost about 8 hours travel from Kampala city to the western side of the country. And then now when the transport system has been brought down, there was completely total lockdown. I have no car personally. I cannot move anywhere. And if you have to move anywhere, you must seek for permission from the residence district commissioner, or you have from police. And in this case, as a trans woman, as a person who works for LGBT issues, it's also difficult for you to go to police to ask the police to give you a letter, because the police will ask you, what do you want a letter for? And then you need to give an explanation, which is a huge problem. You cannot.
Right.
Secondly, remember, most of our area of operation is completely at the border districts. As you know, transgender women mostly cannot get jobs, despite the fact that some of them could have been educated, but because of they are actually very seen. Like, for example, they are so visible in terms of the dressing code, the way they walk, the way they do things. So nobody can actually employ them. So most of them are resorted to stay in the border districts where they can actually have some small business in terms of sex work in order to survive. But most of these sex workers movement, actually, wherever they are, most of them are actually living positively, because that's the only way out to survive, to look for a way how to earn a living, and most of them are living positively. So in this case, during this pandemic and during this lockdown, life became very terrible. In the first place, you are not allowed to work or to go anywhere. You are not allowed to stay with anybody. You are only allowed to isolate yourself. Life is hard. And then there is no money in terms of food or even rent. And then worst of those who are getting their medication, because normally what happened here, people feel what we call self-stigmatization. They are scared of going to the same clinic or to the same hospital in the same district where this person stays, because of that fear of, like, for example, people always have to know that this one lives positively. So that was a challenge. Some of them go to the next district, but remember now, when the lockdown has been brought in place, there is no transport system, life became too hard, they cannot access their medication, they cannot access their food relief in terms of food. Like now, they always give them some small food dietary. They can't get it. Now, at the same time, we do not have any money in terms of emergency money as we used to have. Thank God I saw a call from Outright International, which was requesting people to put in application in terms of food relief. And immediately we did it, and our application was actually granted. That was a blessing. I could not breathe myself because I was more than excited. Then when we received this money, now the problem came in terms of how to give this money to this person who is living about 8 hours drive out of Kampala. Remember, there is no transport system which is allowed to go. If you have to go, you must get a letter. But then later on, we had to associate with one of our network. We have one of the people who work in one of the hospitals in Kampala. It's called Allied Medical Center. So we requested them to help us to get for us a letter and provided us with their car. So once we got that car, we had to drive direct to the gazetted areas where we normally operate and then organize our workshops. In those hotels where we normally organize the workshop, we have to connect with them, and then they allowed us to use the resource center where we normally have the workshop. But now the problem was the government of Uganda did not allow anybody to distribute food. They had formed what we call a task force, government task force. In case you have any donation, you have to donate the money through the government task force. And then it is the government task force to distribute the food or the money or whatever you have given, which is a challenge for us. So what we did, we had to downplay ourselves in the sense that we had to go underground. And then we communicated to the hotel, and the hotel gave us a space. And of course, the hotel was helpful enough to help us identify a store where we could purchase food. And we gave them the money. They are the ones who brought the money they brought the food to the hotel. And then they told us to invite our members to come and pick food one at a time. because the ideally they also not allow to see anybody walking away with the food, but we have to devise means in a sense that one person comes at a time to pick the food, and it all worked. So we purchased rice, beans, maize flour, sugar, milk powder, cooking oil, and other many things. And then, of course, for those who were able to get their medication from different districts, we were also able to use SIM sticker from a live medical health center to go with their documents to collect their medication. We call it the refilling of their medication. In this case, we could ask the doctor of that resource center that give us medication for about 4 or 5 months. That is how we manage, and this is all through from the support of Outright International. I would like to uphold Outright International for the good work, for the support you have given to us. Imagine if Outright International was not in place. I would imagine some of the trans people would have actually died because they cannot access their medication in time. Secondly, they cannot afford food to eat. Sadly, they can also not afford any, like for example, some of them are supposed to take milk, but you cannot afford the milk because milk is too expensive. But because this is support, we are able to purchase milk and provide them with milk.
Thank you, Letitia, so much for that. And I mean, I appreciate that outright support has been helpful. I would also like to suggest, though, that all of you have talked about circumstances that required, in fact, a lot of work and creativity still to make whatever support was coming in work. In fact, I mean, you had to deal with some really difficult circumstances. Letitia, you're just describing the whole issue of not being able to distribute food in a more sort of group way, and so having to come up with a really creative solution to get around that. Not to mention the transportation. Yes, please. Please.
Can I just add something? Yeah, because I am not talking about one region. This is how we worked for all our 4 regions in Uganda. Yes. So we underestimated. We thought we would only support about 100 members, but we ended up supporting almost 220 members. So we had to make sure that we economize this small money we have, and then we were able to see that most of these members were able to move from Eastern region to go and get your medication at the end of the day. The other one is also supposed to move from the Bunyoro region to get the medication and get food. The other one from Southern region or Greater Masaka was also able to get food and go to hospital to pick your medication. Or even one of our staff was able to always move because now we have a sticker. So I must call, in this case, I'm calling upon all the supporters of Outright International to continue donating and supporting Outright International. The small support is a huge difference, especially in Uganda and other parts of the world.
Thanks for that. But again, I would say that it's really your incredible work as activists, as community mobilizers that made this work out in your circumstances. And you all also talked about how sort of having to mobilize under these very difficult circumstances actually led to some sort of new avenues or ways of working with your community. And I think, Alverna, you talked about the empowerment that you saw in the work with your community. I'm just wondering if you all could talk a little bit more about that just for a couple of minutes, and then we're going to try and take some questions from the audience. Actually, whatever else you would like to add, given that you've heard the 3 of you each now share your comments, if there's some thoughts that you have that you'd like to share, but particularly kind of where you see going from here. Because the pandemic, sadly, is not over. Jennifer, do you want to start?
So, just like everyone has mentioned, like, it feels like when everyone was talking, it felt like they were talking about Nigeria as well, because we all had similar experiences when it came to the hardship in distributing those items, and also the kind of issues that people are facing at the moment. So for Nigeria, I believe that I wouldn't say that there's so much change that has happened, to be honest, in terms of how people are living right now. Because first of all, we have we still have the lockdown, but it's a partial lockdown. The economy has still not picked up as quickly as we all assume it will. So things are still moving slowly, so to say. And then most of the requests, or most of the requests you get from people are related to, like I mentioned earlier, psychosocial support. People then talk about their mental health. And not to forget, we had the NSAS movement as well that happened in Nigeria sometime in October, where there was a protest again about the police brutality. So that as well with the COVID-19 has been affected the way people are living. So I think that for us, one of the things we are hoping to do is see how we can improve mental health, basically, because it's like starting from the grassroots. Maybe that could help, but from our own point of view, it's still a bit difficult because we don't really have enough resources in the sense of we don't have so many psychologists or therapists who are well informed when it comes to handling LGBT issues. We still have the SSNPA law in Nigeria, which criminalizes psychologists and mental health clinics, especially that would also want to render their services. So for us, we are now trying to, call out the international people, call out organizations who can render health and services. Hopefully, if we can then start from the grassroots, then in time we can improve other areas. We're still going to keep working on providing to LGBT individuals that are still in need. We have a project which we do every December. It's a Christmas giveaway. So we get donated items and we give it out to LGBT individuals. So we're hoping that we've gotten a very good response this year. So we're hoping that that could also put smiles on faces of people that cannot afford, basic things that they could have afforded this year if we did not have the pandemic. So we're just hoping that we can have things like this, like more empowerment programs, more funding, so we can create safe houses for people because some people are struggling with housing at the moment, so they're just feeding. So those are the kind of things that we're hoping that we can all come together and come up with initiatives that could improve the well-being of LGBT individuals. Yeah.
Right. Thank you. Thank you. Alberna, what about you? One of the questions, and I don't mean to divert from the general question I just asked, but I'm wondering too if you all experienced what you perceived to be. I think Alberna, you mentioned that when you went to get food support, they told you, "Well, we're all done with it." I mean, did you perceive that as was that discriminatory, or was that actually the legitimate situation?
We perceive it as being discriminating against us. We perceive it that way.
Yeah.
We perceive it that way. But as we normally say, God is always in charge, and He promised to take care of us one way or the other, and He did. Mm-hmm. And we were happy when we received, please note my tone and my action, we were happy when we received the grant from Outright to fling it in their face and let them see an international organization, right, made contribution to the same people who voted for you. We were happy to do that. We were happy to do that. And Letitia still there?
I think, yeah, I'm worried she hopefully she'll come back on. Her connection might have dropped.
My heart goes out to Letitia and her organization. When you think you have it bad, there are other persons who have it worse. We also are on lockdown, but as I think I made mention of that, but we work very close with the police and with the police within our country. Thanks again to Outright. The police officers over a period of time, over a number of years, they received training and the sensitization with regards to being more sensitive when dealing with cases of LGBT persons from the LGBTQ communities. Some of the police officers, they are also our trainers. And in fact, Mesh of itself was founded by a police officer because of the issues LGBT persons were facing, and whenever they go to make the report, the response that he was, he saw they were receiving from his fellow colleagues. So that's how the organization was founded. Yes, we also, as I said, we were also young, but what we did during the very time of our assessment, we received the permission from persons who had wanted to be part of this WhatsApp, and thanks to social media WhatsApp group. And we formed that WhatsApp group. But we are a small island, so you can get around in, as we normally say, sometimes you can stay from one end and you can shout across the other. Get around very fast. So what we did, we got our pass from the police first and foremost. And within that group, we asked persons to listen, don't you move, because we know persons are very homophobic and they are going to go for you. And I have once said to them in plain words, if you get catch in the same language, don't call us. You stay put. Whatever it is that you want, okay? You can either WhatsApp us privately or put it in the group. And we are going to make that sort of a connection. So we receive a pass, and myself and another director, we took it turns in terms of, going to deliver stuff. And so I am more known to the police. So she had the pass most of the time. So in case I can say, okay, you go and pick up something from X, Y, and Z, and then to drop off X because of where we are living, she gives the pass. If it happens that I have to do the pickup, I don't necessarily have to go by her to get the pass. I can always go, even if I am stopped by the police. The police, they know me, and they say, hey, I'm just going to deliver whatever it is, and we take it from there. So we have that sort of a relationship. Our legislation is an issue because it is anti-LGBTQ. It is. And again, thanks to Outright, and thanks to Outright, who had started Commons work in terms of assisting us to work towards changing the legislation. We would have gone a very far way now, but COVID came and halt the process. There are so many other things in which I can mention about our organization. What we need to work on right now is to continue with the empowerment of our individuals. And when I say empowerment of the individual, most of our members, they are within the hoteling industry, and they are the unskilled laborers. We had planned, we still have the plan. By now, we would have completed our training session or part of our training in terms of equipping them in terms of whatever skills that they were in need of, so they can go and compete compete on the job market. And then we would have used that, okay, measure it, bring it up to par with other person, and measure that now with persons when they when they are applying for employment, and see exactly where the discrimination, if they indeed would discriminate against LGBT persons because of work. And we know, and they have proven it, they know when you have persons from the community who are working in whatever it is, they put their all into it. They always put their all into it. So our work continues, and again, thanks to Outright International for making it possible for us, and giving us that sort of a hope that while we may not have the support here, okay, or that level of support here, there are persons from the international organization who is doing so for us. And to piggyback on Letitia, what she said, of course, we must give kudos to the donors, because without them, it would not have been possible. And the entire Outright staff for going tirelessly, and not only tirelessly, but keeping us informed as to what it is that is going on, and listen, okay, we are still waiting on the grant, we are still this, and what it is, remarkable. You give us the hope, and the very information we will receive, we always give that back to our community. And thanks again to the WhatsApp group. We put it in the WhatsApp chat because social distancing, we are still doing social distancing and the masking now. All right, we put it in the WhatsApp chat, and for everybody to know exactly what is going on. So we have our work cut out for us, and all we have to do is to keep going and going until such time, and not only going, but ensure that we bring other persons, the younger ones also on board, okay, so that they can carry on the passion, so that all persons from from our community would be able to receive some sort of justice, or get themselves, let's say there's light to the end, at the end of the tunnel.
Let's hope.
Because work must goes on. Let's say that. There's light at the end of the tunnel.
Let's hope that's true for everyone around the world. Thank you so much, Alverna. Again, I want to invite people. We have about 6 more minutes. If people have questions, to put them in the chat. And Letitia, I'm glad you're back. We missed you there for a few moments. I wanted actually just to go back to Jennifer quickly, because you referenced the same-sex marriage prohibition law that exists in Nigeria. And I wonder if you could just say a few words. You mentioned that gets in the way of being able to meet and to share information publicly and this sort of thing. How did you get around that more specifically? In what ways has that law impacted your efforts, both in this and in general?
That law, whenever I think about that law, it just aggravates me, because there's so many things that you can do, and there's so many things that you wish you could do, but you just can't do. Like I said, we don't have a physical space. So all our communication is done through social media. So sometimes when you have like an event, for example, you can't post information on social media, because at the end of the day, it might be raided by police. So everything is always done in silos. All the information we do is on silos. So if I have to now relate it to, in terms of where we were distributing these items, a lot of people, like I mentioned, we had 207 people who filled the survey. But at the end of the day, we could only cater to 133. And the reason we filtered it to 133, when we got the funding from Outright, we called those people. So many people were scared to respond. And which was so painful, because these are people that really needed those items. But when we called them, they would either think it's a setup or someone is trying to blackmail them. So for things like this, it was difficult in reaching out to people who really needed help. And then when you think about in terms of how we had to transport these items, like you said, there was a lockdown. We couldn't tell the police people if they're stopped on the road the reason why we needed to distribute this item, because to us it was essential, but to them, we can't explain what the organization does. So sometimes you have to lie about the things that we do. We have to be very discreet with our information, so that at the end of the day, when you're trying to help people, you don't shoot yourself in the foot as well. So those are the kind of hurdles that we had to pass. And then in terms of the law itself affects the initiatives that we come up with. Like, for example, I mentioned that we would be having the giveaway, the donating items in December. Now, trying to do that will be difficult for us. We have to make sure we have tight security. We have to make sure that even the security guards that we get are people that are trusted. Yeah. And we also have to do everything at a very, very discreet level. So, people you can't even share the information on social media. So what happens to those people that have low finances, that do not have access to social media, or that can't pay for data? So those people would never be involved in events like this that we do at the end of the day. So sometimes, and most times, those are the people that really need the help. Yeah. So we have to think about things like this again. And as I mentioned, we distributed to 21 states. Reaching out to different people in 21 states is a bit difficult. And the lockdown obviously played an impact in making sure that happened. And then logistics prices all hiked up during the COVID. So, and those are things that we did not imagine would happen. So we had so many issues. The law is still playing an impact in how we do so many things, in terms of even registration of your organization, in terms of just reaching out. You can just see how things, the disparities of how things are done in the country. There's this favoritism when it comes to heterosexual needs, and when it comes to the LGBT needs. And those are the things that we're hoping that in time it will change.
Yeah, thank you. Thank you. We have one quick question. We just have a couple of minutes. And so it has to do with getting a full picture of who's affected by COVID in your countries, and whether, so I'll just read the question. It says, I understand that for the community to get a full picture of how LGBTQ plus individuals are really affected by COVID, there's a need to include sexual orientation or gender identity data in collecting COVID testing information. I want to hear your thoughts, because this may be dangerous, as this might increase risk for infringing privacy and increase stigma, particularly in countries where LGBT people are criminalized. What's the workaround? So is that an issue? Are you seeing actually much testing at all in terms of what? Let me leave it at that. Let me let you answer that question.
If I can answer, we have not.
Alverna, sorry. Yes.
We have not experienced persons being asked about their identity in terms of testing, and persons only, persons that were tested are persons who had the symptoms beyond the flu symptoms. But we were happy to brag about it, because it was said in our society also that the LGBTQ persons, they're responsible for COVID. And we were happy to brag with an attitude. Not one person from the LGBTQ plus community has been tested for COVID or Corona. None. We were happy to brag about that. But of course, it's indeed going to be very dangerous. And if it is that they should want that to happen where in Antigua, it is going to be, I think, a plus for us, because we can use it now against the government now to change the laws in order to reflect. We're not asking for anything more, to include persons from the LGBT plus community in everything. So if they are not praying for it, if it happened, it is going to be a plus for us. So we're going to use that to lobby. Yeah. If you can want that from us, why not include us in everything else?
Yeah, that's actually a great point to end on. We do have to close the session, but I think that is a really important point. It's actually not going to be safe to collect those data until the underlying laws are addressed. Yeah. So I want to thank you all so much, Letitia, Jennifer, Alverna, and all of our participants for joining us. There will be an evaluation of the session, I think posted on the website if you want to chime in with your thoughts. The next session is a keynote with Gina Rosero, a trans activist from the Philippines. It should be quite good. So again, thank you all so much for joining us. Appreciate very much your input.
Thank you very much.
And
thank you for
great to talk with you all. All right.
Thank you.
Bye-bye.
Bye.